assisted breath. Or patient could be relaxed or paralyzed, and then machine will deliver cycle by time. So we have three types of ventilation modes: volume controlled, pressure controlled, and pressure controlled volume targeted (PCVT). In other machines, it's PRVC, pressure regulated volume controlled, or volume assured, or volume guarantee. So different brands, different names, but the same background.
Here fix tidal volume and they fix also pressure control.
So for this mode, you are setting up the target volume, and machine will achieve this target volume with the minimum possible airway pressure. So it's adjusting the airway pressure breath by breath.
To reach to my target.
Yeah.
Variant target.
Yes. And here we have tube compensation. That we can compensate tube resistance in percentage. On default, it's not compensated, but doctor can apply a compensation.
According to what? According what would make me choose certain value for compensation?
So if the patient start to breathe spontaneously, he need to perform some work of breathing, right?
Yeah.
And work of breathing consists of overcoming a compliance of chest, resistance of breathing pathways, resistance of tube. So anatomical parts we cannot compensate because they are individual to each patient. But tubes already standardized by length, by size, and resistance of tube is known. Yes. And it is recorded in the ventilator.
Does the doctor know how much resistance of each tube?
Machine knows. But doctor can apply partial or full compensation of tube resistance to decrease work of breathing of patient while he starts to breathe spontaneously. So while patient is weak, this work of breathing could be dramatical for him. He will tire very fast because of work of breathing. He is weak enough. But during the weaning procedure, we need to train breathing muscles of patient to wean him to extubation. So from the beginning, it can be applied 100%, and patient getting stronger, we reduce compensation level in such a way, loading him little bit with extra resistance to train him his breathing muscles, and until it will come to the 0 point.
So for a non-conscious patient or
it's for spontaneous breathing.
Makes a tube compensation 100%.
Yeah, but sometimes if the resistance of tube or tube is very small and resistance of tube is high,
yeah,
and any resistance will cause a delay in pressure saturation. But we need to inflate patient faster for some clinical cases. In this case, we apply a tube compensation, and machine will raise pressure faster to higher level, but on patient wide. And in lungs, we will get the target result. Okay?
This is for small tubes.
Yeah. So tube compensation is a function that is available for expert class ventilators. So it's not available for simple machines. It's not available for low class machines. So we position our ventilators as an expert class ICU ventilator. And certain functions must be here if we positioning it as an expert class machine. Okay, so while we're explaining the respiratory mode settings, there are two main groups: parameters available for setup and parameters which is calculated. So some of the doctors, they have adults because they accustomed to set up inspiratory time in spite of IE ratio. But how we explain it, that in mandatory modes, you have just IE ratio settings. But as soon as you change the IE ratio, you can identify how it will influence inspiratory time live. So some of the ventilators will show you resulted value only when you apply it. But before it, you doctors who he said, oh, I don't like to set up the IE ratio. You said, no problem. You just press it, and by turning the wheel knob, you are setting up inspiratory time actually, because it's a changeable value of the same mathematical
Equation.
equation. So doesn't matter what kind you change, what part of
If it
equation
is
you
in
change.
inspiratory, you can do
Yeah.
it from IE ratio.
Yes. Okay.
And then beeps. This is the baseline of the ventilation. The beep.
Yeah. So other settings. So oxygen concentration, target volume for PCVT, IE ratio F, it's breath rate, positive and expiratory pressure, rise time. It's how fast patient will be inflated, the flow acceleration and on inspiratory part of the graph.
Yeah, sometimes square wave,
It can be
sometimes triangle.
it can be fast inflated or slowly inflated. It's in percentage of inspiratory time.
Mm.
So if and on default value it's 10%, that means from the start of inspiratory cycle until we will reach dedicated pressure inspiratory, it will take us 10% of this inspiratory time.
Okay.
So if we will need to inflate patient faster, then it goes to 0, or slowly